Hello viewers, welcome back for a new video. I am Beulah Dollars, Associate Professor Community Health Nursing Department, M College of Nursing. The objective of this session is, at the end of this session, the learner will be able to understand about LaQshya. What is LaQshya? It's a labor room quality improvement initiative guideline. It was initially started in the year of 2018 and 19 in Karnataka. These guidelines are intended for achieving improvements in the intrapartum and immediate postpartum care which are take place in the labor room and maternity operation theatre. So what is the main aim? We are giving care or giving important or following the guidelines during intrapartum or immediate postpartum care means it's a very crucial time to save the mother and the child. What is the goals of this LaQshya program? To reduce preventable maternal and newborn mortality, morbidity, and stillbirths associated with care around delivery in labor room and in the maternity OT. To ensure respectful maternity care to the mother and child. The main objectives of this initiative is to reduce maternal and newborn mortality and morbidity. It is caused due to antepartum hemorrhage, postpartum hemorrhage, retained placenta, preterm, preeclampsia and eclampsia, obstructed labor, puerperal sepsis, newborn asphyxia and sepsis, etc. The next objective is to improve quality of care during the delivery and immediate postpartum care, stabilization of complications and ensure timely referrals and enable an effective two-way follow-up system. To enhance satisfaction of beneficiaries visiting the health facilities and provide respectful maternity care to all pregnant women attending the public health facility. Let's see about the labor room use. What are the activities can be allowed to do it in the labor room? The first thing is providing privacy to the pregnant women during the intrapartum period by the way of separate labor room or at least a private cubicle can be provided to her. Presence of birth companion during the labor. Freedom to choose a comfortable position during birthing. That is maybe a squatting position or maybe a standing position, whatever it is comfortable to the mother, that can be allowed. Adherence to clinical protocols for management of labor, use of labor beds instead of tables, place baby on mother's abdomen, initiation of breastfeeding within 1 hour after the birth. What are the things not to be done in the labor room? That is the don'ts in labor room. Induction and augmentation of labor without sound clinical indications. Any verbal or physical abuse of the pregnant woman. Insisting on conventional lithotomy position for the delivery. Immediate clamping and cutting of the umbilical cord. Separating baby from the mother for routine care and procedure. Out-of-pocket expenditures on drugs, diagnostics, including demand by the staff for gratuitous payment by families for celebration of the baby's birth. What are the strategies to maintain or obtain the quality of care in the labor room? First one is reorganizing or aligning the labor room and the maternity operation theatre layout and workflow as per labor room standardization guidelines and maternal and newborn health toolkit which is issued by the Ministry of Health and Family Welfare, Government of India. Ensuring that at least all government medical college hospitals and high case load district hospitals have dedicated obstetric high dependency units as per Government of India, Ministry of Health and Family Welfare guidelines for managing complicated pregnancies that require life-saving critical care. ensuring strict adherence to clinical protocols for management and stabilization of the complications before referral to the higher centers. Let's see the priority of this LaQshya initiatives. The all government medical colleges hospitals, all district hospitals and equivalent health facilities, all designated first referral units and high case load community health centers with over 100 deliveries per month in a normal area or 60 deliveries per month in the hills and the desert areas. Let's see the targets of this LaQshya initiatives. There are certain periods to achieve some targets. Let's see the immediate targets to achieve within 4 months. 80% of the selected labor rooms and maternity operation theatres assess their quality and staff competence using defined National Quality Assurance Standard checklist and ASCII for the staff. 80% of the labor rooms and maternity operation theatres have set up functional quality circles and facilities level quality teams. Next thing is short-term target, that is up to 8 months. That is between 4 to 8 months. 80% of the labor room and our operation theatre quality circles are oriented to latest labor room protocols, quality improvement processes, and respectful maternity care. 50% of deliveries takes place in presence of the birth companions. 60% of deliveries conducted using safe birth checklist and safe surgery checklist in labor room and maternity operation theatre respectively. 60% of the deliveries are conducted using real-time photograph. 30% increase in breastfeeding within 1 hour of delivery. 80% of labor rooms and maternity operation theatres takes microbiological samples from defined areas every month. 30% reduction in surgical site infection rate in the maternity OT. Intermediate term targets are, that is up to 12 months, 30% increase in antenatal corticosteroid administration in case of preterm labor, 30% reduction in preeclampsia, eclampsia and pregnancy-induced hypertension-related mortality, 30% reduction in antepartum hemorrhage or postpartum hemorrhage-related mortality, 20% reduction in newborn asphyxia-related admissions in special newborn care units for inborn deliveries. 20% reduction in newborn sepsis rate in special newborn care unit for inborn deliveries. 20% reduction in stillbirth rate. 80% of all beneficiaries are either satisfied or highly satisfied. 60% of the labor rooms are reorganized as per guidelines for standardization of labor rooms at delivery points. 80% of labor rooms having staffing as per defined norms. 100% compliance to administration of oxytocin immediately after birth in order to prevent PPH. 30% improvement in ASCII scores of labor room staffs in order to improve their competencies to conduct safe delivery. 100% maternal death, neonatal death audit and clinical discussion on near maternal and neonatal complications. 80% labor room and operation theatres are reporting zero stock out of drugs and consumables. Let's see the long-term targets, that is up to 18 months, 1.5 years. 60% of labor rooms achieve quality certification against the National Quality Assurance Standard. 50% of labor rooms are linked to obstetrics high dependency unit or ICU. 50% improvement in short-term and intermediate targets. After 18 months, this initiative would be continued through sustained interim. Let's see care and cognitive development of baby. The rapid improvement events. There are 6 cycles are there. The first cycle is real-time photograph generation, including shift to electronic photograph and usage of safe birth checklist and surgical safety checklist and strengthening documentation practices for generating robust data for driving improvement. And the second cycle is presence of birth companion during delivery, respectful maternity care and enhancement of patient satisfaction. The third cycle is assessment, triage, and timely management of complications, including strengthening of referral protocols. Cycle 4 is management of labor as per protocols, including active management of the third stage of labor. Shortly, we can call it as AMTSL, and rational use of oxytocin. Cycle 5 is essential and emergency care of newborn and preterm babies, including management of birth asphyxia and timely initiation of breastfeeding, as well as kangaroo mother care for preterm newborn. Cycle 6 is infection prevention, including biomedical waste management. Zoning in OT. There are 4 zones are there. Protected zone, that is reception, waiting area, trolley bay, change rooms, rooms of administrative staff, stores and record, conference room, etc. The second zone is clean area, pre-operative, post-operative, plaster room, staff lounges, stores, etc. Third zone is sterile area, operating theatre, scrub room, anesthesia and setup room. Fourth zone is disposable area, that is dirt utility, disposal areas from each OT and corridor leading to disposal zone, disposal corridor. So these are the place we have to keep the listed items in a particular zone. In operational theatre, functional pre and post-operative area should be there. Dedicated nursing staff for pre and post-operative area should be appointed. Availability of essential equipments, maintenance and calibration that should be done properly. Cleaning and disinfection protocol need to be followed. Availability of anesthesia services is very essential, and monitoring the indicators of health which is related to reducing the morbidity and mortality related to maternal childbirth. Let me summarize this session. In this session, we have discussed about what is LaQshya and what are the aims and objectives of LaQshya, strategies and the targets to be achieved in this initiative guidelines, and do's and don'ts in labor room and in the maternity OTs. Let me conclude this topic. LaQshya is all about improving quality of care around birth, quality certification of labor room and the maternity operation theatre through the existing system, the attainment of 75% of facility level targets. At least 80% of the beneficiaries are satisfied with this care. Thank you for your patience listening.